Hello everybody, my name is Ngozi Ebu. I'm a certified nurse practitioner. On my last video, I talked about signs of heart attack. And on this video, I would like to address some of the risk factors that we need to implement to decrease the chances of ending up with a heart disease. So according to Center for Disease Control and American Heart Association, heart disease is actually the number one killer here in the United States. So knowing this risk factor and implementing it in your day-to-day lifestyle changes, that will minimize the chances of having a heart disease. So the risk factors are classified under two categories. We have the modifiable and unmodifiable. The modifiable risk factors are the things that we can change, while the unmodifiable risk factors we cannot change. So let's address the unmodifiable risk factors first. The unmodifiable risk factors include age, gender. So as you increase in age, the chances increases of having a heart disease. And then gender, men tend to have heart disease. The rates for men are higher than women, only before menopause. Post-menopausal, the number evens out. And then family history. So those we cannot change, the age, the gender, and the family history. Now let's focus more on the things that we can change. Those are high blood pressure, high cholesterol, diabetes, overweight, stress, excessive alcohol use, smoking, substance abuse, and poor dieting. Let's address it individually. So high blood pressure, we need, according to American Heart Association, we need to maintain blood pressure 130/80. So 130 systolic and diastolic of 80. Previously, it used to be 120 systolic and diastolic of 80, but they have changed it to 130/80 now. So because what happens when your blood pressure is high, you're increasing the workload of the heart. So the heart is working hard because of that high blood pressure. And over time, it will thicken, and then that will end up decreasing the efficiency of your heart valves. So now cholesterol. High cholesterol in your blood forms plaque, which occlude the passage of blood. So we need to make sure that your cholesterol level is on the normal range. So it's very important that you visit your healthcare professional at least annually to have that annual physical and blood work. Because we look at your total cholesterol, we want to make sure your total cholesterol is less than 200. We look at your LDL, which is the low density lipoprotein, which is also we call the bad cholesterol. We want it to be less than 100. And we look at the HDL, which is the good cholesterol. We want it to be for men above 40 and for female above 50. And we also look at the triglyceride. We want it to be less than 150. So it's imperative to have an annual checkup, because that's the only way you know if your cholesterol level is normal or if it's increasing. Obesity. So the more you're putting more adipose tissue in your system, the more the heart is working hard. So it increases the stroke volume and also increases the cardiac output. So all this stuff, the heart is working hard to be able to keep up with the metabolic demand of those excessive adipose tissue. So please try to maintain a good weight management. Diabetes. So when it comes to diabetes, when you do go for your annual checkup, we also watch what we call hemoglobin A1C. So the hemoglobin A1C will tell us where you are, if you're diabetic, pre-diabetic, or you're normal. So we always want that number to be less than 6%. Anything above 6% is pre-diabetic. And then if it's above 6.5, it's diabetic. So we want to make sure that that hemoglobin A1C is at the normal range. And then if you're already diabetic, complying to your medication regimen is very, very important. Okay? Stress. We all have stress, but the best thing is finding ways to cope with stress. Because when you're stressed, what happens? Your blood pressure increases, your heart rate increases, your muscle is tensed, you're depressed. And not only that, your body is producing all this stress hormone like cortisol and adrenaline, which is not good for your system. So it's very good to be able to find things that you can do to manage your stress. If it means taking a walk, if it means yoga, if it means meditation, anything, you know, meaningful relationships, surrounding yourself with friends and family, that's a good way to decrease stress. So it's very important to make sure that you decrease your stress level. Smoking. Smoking causes increased formation of plaque in your system. So please, if you're smoking, talk to your primary care physician so we can figure out ways that we can implement some smoking cessation. Excessive alcohol intake. Alcohol, yeah, you know, there's studies that have shown that alcohol is good. Maybe 1 glass of wine every now and then is good for your heart. But I also want you to know that men metabolize alcohol faster than females. So the recommendation is 2 glasses for men and 1 glass a day, 1 glass for female, because we metabolize alcohol slower than men. So please bear that in mind. Then another one is poor diet or poor nutrition. So we need to cut down saturated fat, trans fat, high cholesterol, high salt intake, cut down on red meat, focus more on like fish, chicken, vegetable, and non-animal protein. That will help. And then substance abuse, things like cocaine, marijuana, ecstasy, heroin, those stuff increase what called the blood pressure and your heart rate and increase the work of your heart, and that is not good for your heart. So knowing all these factors and be able to work on it to decrease those factors will significantly lower this number of deaths in the United States. So even though there's unmodifiable risk factors, but knowing those ones that you can prevent. So heart disease is preventable. So knowing those factors that you can control by changing your lifestyle, modifying your lifestyle, can significantly decrease the chances of ending up with a heart disease. So if this video have helped you in any way, give me a thumbs up. Share this video because knowledge is power. I'm trying to create awareness out there so that we can find ways to be healthy, so that our heart will thank us. Our body is our temple. We need to love ourselves and take care of ourselves. Don't forget to press the subscribe in case I put up new video, you'll be notified. Have a good night.